Today we're going to be talking about an Abilify commercial for treatment-resistant depression. Let's check it out and let's see how the manufacturer was marketing it to patients.
It's me, and here's my depression. Before I started taking Abilify, I was taking an antidepressant alone. Most days I could get out from under and carry on, but other days I still struggled with my depression. I was handling it, but sometimes it still dragged me down. I'd been feeling stuck for a long time. So I talked to my doctor, and she added Abilify to my antidepressant. She said it could help with my depression, and that some people had symptom improvement as early as 1 to 2 weeks. I'm glad I talked to her. I wish I'd done it sooner. Now I feel more in control of my depression.
Abilify is not for everyone. Call your doctor if your depression worsens or you have unusual changes in behavior or thoughts of suicide. Antidepressants can increase these in children, teens, and young adults. Elderly dementia patients taking Abilify have an increased risk of death or stroke. Call your doctor if you have high fever, stiff muscles, and confusion to address a possible life-threatening condition, or if you have uncontrollable muscle movements, as these could become permanent. High blood sugar has been reported with Abilify and medicines like it, and in extreme cases can lead to coma or death. Other risks include increased cholesterol, weight gain, decreases in white blood cells, which can be serious, dizziness on standing, seizures, trouble swallowing, and impaired judgment or motor skills.
I have to say this is a pretty good list of side effects to the medication. For an ad, I actually think it's a lot more comprehensive than what people hear when they get this medication from their doctor. I actually think people hear something along the lines of, it's a relatively safe medication. They probably hear something like Abilify is more weight neutral because all of the other antipsychotics used for the treatment of depression seem to cause weight gain. And it's probably all people hear. This list of terrifying sounding side effects, they're all true. And it's, I guess that, they actually included it in the ad, which was great.
Always hanging over me. Then my doctor added Abilify to my antidepressant. Now I feel better.
If you're still struggling with depression, talk to your doctor to see if the option of adding Abilify is right for you. And be sure to ask about the free trial offer.
The final thing at the end, which is interesting, is obviously that ad came out when Abilify was still a branded drug and there weren't any generics. And so that's what they do, essentially. They'll go around to the doctor's offices and they'll give them all of these trials so the patients can try it. And if they have a good response to that, essentially, as we know with these medications, they cause an awful lot of dependence. You simply cannot stop taking them that easily. And so they give you the free trial, so you start to take them, and then you end up just using it and buying it through your insurance or out of pocket, which is another interesting Easter egg in this commercial where they were priming people to start getting the free handouts. So there you go. That's the ad on Abilify.